dignitaries on the dais. See, first of all, I'd like to thank Dr. Murthy for associating me with ACT now, I think, actively for last 3 years, I can say. Earlier also we knew each other through different activities, but ACT now for last 3 years, and the kind of work which is being done is stupendous. I have lost count, but I think in last 3 years, more than 1,600 doctors have been, doctors and health activists, I'll say, have been felicitated through this organization, many of them in this room itself. Besides that, I don't know whether he has told, see, help to the needy people, to the physically challenged, few orphan girls also. He has taken the responsibility to bring them up with all dignity, with all support, education, etc. And free food Annadanam was being continued last year for several weeks. And last few weeks, I have seen him distributing blankets to the needy during the night on the street, to the street dwellers, if I can say, or who have no shelter. See, these are not small things which he is doing, if I can say, leading by himself. Others are supporting him. I'm not saying it's a solo job. Others are supporting him, but the lead is being taken by him, and that's a very commendable job. See, most of us who are here, I'll say we are fortunate. See, fortunate means we do not have to think much about our bread, butter, how the house will run at this stage. In the past, it would have been there for few of us. Okay, I'm not doubting that, but today. So now is the time when we are well off, to whatever level we are well off, to help others. See, so that once it becomes the motto, then different kinds of options keep on coming to us. I will tell few things about Red Cross. If so many of you may be knowing, see, Red Cross is an organization spread over many countries. That's a different thing, but only for the state. We primarily deal in blood donation and related activities. We have 8 blood storage cum blood banks in the state of Telangana, and we are starting 2 more in the next few months. And when I say that, see, each blood bank comes at a cost of more than 1 crore by way of equipment itself. We are fortunate we get that kind of donation from different agencies. So we do everything free. Last year we collected about 45,000 units of blood. 1/3 we give it back to the government hospitals. About 1/3 is utilized for treatment of about 500 disease where blood transfusion is done every thalassemia. So about 500 thalassemia patients are given blood transfusion every 2 to 3 weeks, depending upon their requirement, free at 3 centers where this facility is there, because plasma and all that, see, those cost more. See, so we have been able to start only at 3 places here, Warangal and Mancherial. We provide through donations only, not, I don't contribute my money, I contribute my time and effort. We provide free food to the attendant also on that day, and transport charges also to many of them who need that. So if you know anyone who is in need for thalassemia patient who is in need of assistance, especially in these 3 places, or who can travel to these 3 places, Hyderabad, Hanamkonda and Mancherial, please tell us. We will be able to take care of them. Besides that, there are other activities which are done. See, 3 small maternity daycare centers, maternity and child care centers in Secunderabad area. We run about 20 to 25 bedded. Also Alzheimer daycare center, AIDS care center in Old City area. One old age home also with limited beds in Moinabad. plus the districts do their activities independently. So we are now focusing on what is called hygiene kits and the food kits, nutrition kits for the TB patients. There are identified about 27,000 TB patients in this state. We have been able to cover about 9 to 10,000 through whatever donations we get. We look for more. It costs, I think, about 800 per month, the total hygiene cum nutrition kit to them. And in few months, we will be taking up supportive activity for the leprosy patients also as a part of national drive. So blood health camps we conduct in collaboration with other organizations also. We don't do everything ourselves because we get some grants from the government also, but not salary, etc. So through one organization, for example, collaboration, we are planning to have a cancer care center, not the treatment, because many patients lose interest because of financial and other logistical reasons to continue the treatment after the first chemo or this thing. So if they can be stationed in some locality where the medical needs can be taken care of, their food can be taken care of, and one attendant also. So most probably we may start it in next 1 or 2 months, this kind of facility also in collaboration with another. And like I said, you see the Alzheimer Care Center and the AIDS Care Center, we do in collaboration with separate agencies who are, in fact, her name I am forgetting, the organization name is Chevta. The lady running it was the first publicly proclaimed AIDS patient in Hyderabad. I have. So see, those kind of things we support with our limited means, and we work for wherever we get funds, and we are fortunate we keep on getting, because plus any old age attendance also we are into that assistance, I'll say, not free, but we train them and then place them for the first time in the houses where they are needed. After that, if they want on their own, they can move ahead, or if they come back to us after 1 year, 2 years, whenever, then we again find jobs for them. So different kinds of activities, and we are trying to increase our activities depending upon our capability also. So I am happy once again at the work which ACT now is also doing, and I congratulate him, and also the doctors. I have one advice for the doctors, and it's not my advice, it was I think either Dr. Shetty or he told in some interview. Dr. Shetty, you all must be knowing, he's a nationally renowned surgeon. He said, others will like to treat you as God. See, when you save life of anyone, then the patient, his family will like to treat you as God. But as a doctor, you never think of yourself as a God. Thank you.